Hello and welcome back to Dr. Skeletal Medical Channel. Here we discuss about various medical issues and the topic for today's discussion is iron deficiency anemia. Now what is iron deficiency anemia? But before that, what does anemia means? Anemia means low hemoglobin or hematocrits or simply low red blood cell below a threshold level. Now we have standard values of hemoglobin and hematocrits. For a healthy adult male, it's less than 13 gram per dl and less than 0.41 of hematocrits. And for a healthy adult female, it's less than 12 gram per dl and less than 0.38 of hematocrit respectively. The average lifespan of red blood cell is 120 days. In bone marrow, there is a continuous production of red blood cell by the process of erythropoiesis. So there is continuous need of iron in our body. Daily dietary requirement of iron is, for a healthy adult male over the age of 18, it's 8.7 mg per day. For a healthy adult female, age ranging from 19 to 50, it's 14.8 mg per day. But for a woman over the age of 50, it's 8.7 mg per day, considering that she has already gone through menopause. Iron deficiency anemia. It is a type of microcytic anemia. Micro means small. Cytic cell, small cell anemia. It is the most common type of anemia globally. Around 10% of women in the reproductive age group suffers from iron deficiency anemia or simply IDA. Also, young children, infant and prematurely delivered baby are at high risk. Before going any further, we have to be clear about why and how question to understand any topic in scientific manner. So why and how exactly does the iron deficiency lead to microcytic anemia? If we see the erythropoiesis process going down from proerythroblasts to erythrocytes, as the cell keeps on losing organelles like mitochondria, ribosome and even nucleus, the cell keeps on shrinking and keeps on waiting for iron to combine. But as we all know that it's iron deficiency, so iron is nowhere to be found, so cell keeps on shrinking. That is why in iron deficiency anemia, the cell size is relatively small, hence microcytic anemia. Let's discuss on what are the cause of iron deficiency anemia. Basically, there are three major causes of iron deficiency anemia: decreased intake, increased loss, and increased utilization. Further discussing on decreased intake, it has two major categories. First, nutritional deficiency, like premature baby, feeding infant and cow's milk instead of breast milk, as there is a difference in iron composition in cow's milk and breast milk, strict vegan and vegetarian diets, and poverty. Going on malabsorption, the second category of decreased intake, we have celiac disease, Crohn's disease, and even gastrointestinal surgery. Continuing the causes, we have increased loss. It is further divided into two categories. First being increased blood loss or simply direct blood loss. Menstruation in reproductively active female, especially menorrhagia. What does menorrhagia means? Increased blood loss or simply overbleeding for 7 days or more in a row. It is the major cause of increased blood loss in reproductively active females. We have GI bleeding, peptic ulcer in adult, and Meckel's diverticulum in kids. We have hookworm and other blood parasitic infection. We also have colon cancer and polyps. In other than reproductively active female, GI bleeding is the major cause of increased blood loss. Chronic nose bleeding, we even have urinary blood loss and also major accidents. Giving the second category, we have intravascular hemolysis. G6PD, glucose 6-phosphate dehydrogenase deficiency. We have paroxysmal nocturnal hemoglobinuria or simple PNA, sickle cell anemia, transfusion of ABO incompatible bloods. We also have thrombotic thrombocytopenic purpura. Third and final cause, we have increased utilization. The overall demand has been increased here during growth and development from childhood to late teenage because the body is developing. And we have pregnancy and lactation. Makes sense, because female is not only feeding her, rather she is also feeding her babies. Signs and symptoms of iron deficiency anemia. What do we have here? Fatigue, weakness, shortness of breath, dizziness, general symptoms of anemia. But we also have some specific signs and symptoms of iron deficiency anemia, like angular cheilitis, inflammation and small cracks on one or both corners of our mouth. We have atrophic glossitis, partial or complete absence of filiform papillae and tongue. We have aphthous ulcer, ulcerative condition of oral mucosa. Koilonychia or quail nail, it is spawn-like nail condition. Eclohydria, condition in which stomach does not produce enough hydrochloric acid. Hydrochloric acid is very essential to convert ferric into ferrous iron, which is better absorbed. Plumber-Vinson syndrome, problem during swallowing due to small thin outgrowth of tissue in esophagus and blocking the pipe. We also have pica, craving for ice and other inedible objects. Restless leg syndrome is other sign and symptoms of iron deficiency anemia. Diagnosis of iron deficiency anemia. Bone marrow biopsy by far is the gold standard of diagnosis. Yet we usually do not perform this procedure because it's really painful and complex procedure. Rather, we go with total blood count. During blood profile also, we can easily detect if iron is the main cause or not. We can see decreased hemoglobin and hematocrit concentration. We can see the decreased mean corpuscular volume. Also decreased mean corpuscular hemoglobin concentration. Low reticulocytes or red blood cell. But surprisingly, we see a high platelets. And you may ask, why is that? Because red blood cell and platelets forming process is so much similar. So body tries to compensate. And of course, serum ferritin level and serum iron level are low. We have increased total iron binding capacity. Makes sense, because iron is low, so body tries to bind with as much iron as possible. We have decreased saturation since iron is low, and we have decreased white blood cell, but other than parasitic infection. Here we see increased WBC, especially eosinophil. Treating of any disease in general requires the treatment of underlying causes. Here, change in lifestyle and diet is the major treatment. We actually have three major categories here. First, increase in diet that is rich in iron. Actually, we have two kinds of iron, heme iron and non-heme iron. Heme iron, they are well absorbed and they are derived from animal source. Whereas non-heme iron, they are poorly absorbed and are derived from plant source. Along with increasing diet that is rich in iron, we should also increase vitamin C in our diet. Why is that? Because vitamin C helps us to absorb iron from our food. We can increase citrus food, tomatoes, kiwi, even pineapples. We can go with broccoli and green leafy vegetables in general. Even dry nuts has shown the remarkable progress. Along with this, we should also decrease the intake of caffeine and dairy products. Why is that? Because caffeine, like coffee and tea, and dairy product that is high in calcium decreases the iron absorption in our body. But sometimes, these dietary changes cannot compensate all the iron losses. In that case, we should go on pharmaceutical help. Method. Ferrous sulphate is our drug of choice. We should take them in pill form in empty stomach. Why is that? In empty stomach, it is better absorbed. But a lot of time, patient complains about having some stomach cramps, nausea, and diarrhea while they are taking pills in empty stomach. Here, we recommend them to take these drugs after taking certain foods. But for the patient who have had gastrointestinal surgeries or some other issues like Crohn's disease and celiac disease, the iron cannot be absorbed properly. Why is that? Because celiac disease and Crohn's disease, they primarily affect the duodenum. It is also the primary place for iron absorption. Here, we have to give iron dextrone in a syringe form, in intramuscular or intravenously. If you find our content helpful, do consider to like, share and subscribe to Dr. Skeleton Medical channel, and also don't forget to ring on the bell notification. Thank you.